Good morning, everybody. Good morning. So my name is Anna Drage. I'm a program coordinator for one of the scholarships over at CPCC. So I'm going to be doing some introductions, and I'm really excited to introduce the Breaking Down Barriers, Strategies for Overcoming Employment Hurdles and Promoting Economic Ability section of today. So I'm going to introduce our lovely panelists. We'll start with Ms. Jeanette Singerman. She is the president and CEO of the Childcare Resources, Inc., CCRI, which is headquartered in Charlotte. Singerman also serves as the leader for the North Carolina Childcare Resource and Referral Council, which manages and supports North Carolina's statewide system of 14 regional lead CCR&R agencies and over 50 local CCR&R agencies. Next, we have Ms. Raquel Lynch. She is the Chief Program Officer of Goodwill Industries of Southern Piedmont. As Chief Program Officer at Goodwill Industries of the Southern Piedmont, Raquel leads all workforce programs, services, partnerships, trainings, and all talent development efforts and more to help individuals and families see possibilities, seize opportunities, and prosper. Ralphine Codwell is the first Executive Director of New Charlotte Office for Local Initiative Support Corporation, or LISC. Ralphine oversees a team that manages a $53 million private sector fund raised by local foundation, lenders, energy, and health systems to expand affordable housing in Charlotte. Ralphine will also be our moderator today. Lastly, we have Ms. Cynthia Bailey of Atrium Health. She is team manager and responsible for implementing the Career Development Center outside and inside up initiatives. Cynthia oversees the Restorative Pathways Program, RN Educational Assistance, Education That Works, apprenticeships, and is part of the team to expand workforce development programs throughout all Atrium Health locations. We are really excited to have you guys, and I will turn it over to our moderator.
Good morning. Oh, y'all can do better than that. Good morning. Good morning. Thank you all for joining us today. We are excited to have a conversation with you today. I want to read something to you, and then we're going to get started. The U.S. Department of Labor has shown strong growth in recent years. However, lower-income resident communities have not always experienced the benefits. Residents often lack the necessary resources, opportunities, and capabilities to find and maintain jobs with decent pay, so they are less likely to work than people living in higher-income communities. Factors affecting such: job availability and pay, qualifications, education, training, transportation, childcare and family issues, crime and substance abuse, housing instability, disabilities, and mental and physical health, including public assistance programs. From that statement, you can tell that this is not a one-size-fits-all, right? So today we're going to take a deeper dive with these incredible ladies that I have here with me, practitioners, and we want you to walk away with some strategies for addressing key barriers that our residents are facing for accessing employment opportunities. So I'm going to let's start with you, Janet. Let's start with you. Childcare Resources assists folks with residents with identifying childcare, along with many other things that you all are doing. How does childcare access affect employment in your work?
Well, simply, given the population trends that you're talking about and given the workforce trends that we're all experiencing, employers now are more focused than I think they have been since the 1980s on attracting and removing barriers to employment. And for a parent with a young child, a parent with a young child can't work unless they have access to someone who will partner with them to take care of their child, right? And so many families partner with other family members for this. Mm-hmm. But also many families don't have other family members available to partner with, and so they turn to formal regulated childcare for services. And so childcare is really, just like housing and some of the other things we're going to be talking about, it is a prerequisite for working parents to be able to participate in the workforce. And so the work that we do in this region and across the state is to build access to quality childcare. Mm-hmm. And help families afford the cost of childcare, because childcare is pretty expensive. Mm-hmm. And so the good news is that in terms of our market, we have about 49,000 childcare spaces in Mecklenburg County alone. And most of those spaces per licensing standards are high quality spaces. So they're 4 and 5 star. 71 to 74% are 4 and 5 star. And so we have access to a robust system of mostly childcare centers and some family childcare homes that can provide care mostly during traditional hours care. So when we talk about barriers to employment, childcare is not readily available in evenings, weekends. So that's a challenge that we have. But it is available for birth to 5-year-olds and birth to 12-year-olds at relatively high quality. That's the good news. And so what's the bad news and the challenging news? Cost, right? Affordability is the issue. And so infant care in a Mecklenburg Child Care Center is about $16,000 a year. It's more than $16,000 a year in a center. That is more than double the cost of college tuition at UNCC, more than double the cost of CPCC, more than double the cost at Chapel Hill. And think about it, parents are in their earlier earning years.
Yes,
You know, you save over time to afford the cost of college education, but young families struggle to afford the cost of childcare. And so that's a barrier to workforce participation, because if you can't access childcare, if it isn't reliable, if it isn't good quality, you don't come to work. You can't get employed, and staying employed is challenging if you're worrying about your children all the time, right? So we have lots of good news, and we also have challenging news. Childcare right now is kind of sitting at a precipice. We know there's a workforce shortage generally, but federal funding kept childcare open during the pandemic. We had about $1.3 billion in childcare for a year in North Carolina. That funding is ending June 30th. It will be reduced to about $400 million. So we have a $900 million funding cliff about to happen, and childcare has never been adequately financed. That's why it's so expensive for families to afford. And so unless there's state action, unless there's federal action, unless there's private sector and employer action, we're going to see a cliff in childcare. We just did a study statewide, and we learned that 3 in 10 childcare programs expect to be closed within 4 to 6 months of the end of this funding cliff. Statewide, that means about over 1,500 programs and over 72,000 slots. So at a time when we're trying to reduce barriers to employment, childcare will become a bigger barrier to employment if we don't get the investment that we need from the public sector or from the private sector. So a lot is at stake right now. Good news is we've built supply. It is, relatively speaking, higher quality supply. It is difficult for families to afford. That becomes a barrier to entrance and sustained employment. And what's good news, I guess, I'll leave you with some good news, is that employers are noticing this. You know, I started this work a long time ago in the 1980s. Sorry, I look real different from that picture.
Look, we're not a day over 30. Don't play. Don't play. We're not a day over 30. Go ahead.
And it was in the 1980s that there was this national report done by the Hudson Institute, Workforce 2000, and it first identified the workforce shortage that was coming in the 80s, in the early 90s. And it was then that employers began to get interested in removing these barriers to workforce participation, particularly to attract women into the workforce and mothers into the workforce. And so that's when employer-supported childcare began as a field, work-family policy began as a field, and those were really exciting times. But as we had recession and the whole panoply of work-family expanded well beyond childcare, some of that receded. Now we're getting employer engagement again because everyone is recognizing that we need to remove barriers to employment. So the Chamber just did a study last May about what North Carolinians and employers think is important. And across the board, parents said what you would expect. Childcare is a barrier to workforce participation. But interestingly now, employers are saying that it is a barrier to workforce participation, and voters across parties, a bipartisan spectrum, are saying North Carolina should invest in childcare, because if we don't invest in childcare, we're not going to have the kind of robust workforce that we want to see and the robust economy that we want to see.
Wonderful. Thank you for that. Let's talk a little bit about transportation. Cynthia, you work with Atrium. Atrium has about 70,000, I think, employees in this region. And What are you seeing as it relates to breaking down transportation barriers? Because we know that's also a factor as it relates to employment. So talk to us a little bit about that.
Absolutely. So with Atrium Health, our team focuses on our frontline teammates, the workforce development programs, and so oftentimes those teammates have transportation barriers. We have decided as a group to, I know there's other agencies that provide the transportation resources, but we had to kind of lean in a little bit better and partner with Lyft and offer passes for our teammates. And so that has been a game changer for our folks because they need round-the-clock transportation. Oftentimes the buses don't run 24/7, and so our staff need that kind of constant transportation access. So that's something we've been offering to our workforce development participants. It is high usage. Even, our teammates who might have access to the bus line or other resources, we have found that having the Lyft pass just makes it easier. Some people just don't want to ride the bus. We've seen some, safety issues sometimes. And so just having that extra comfort for them, helping them get to work, not having to worry about that barrier really has been significant for our folks. I know some employers, if there's any HR folks in the room, there's this benefit issue or the tax issue that you have to consider when you're giving something like Lyft passes to your employees. And so one of the things that we do is we pay the taxes for our employees when we offer them this transportation benefit. Again, we're working with our frontline teammates, and so not a lot of disposable income. And so we remove that barrier of those extra taxes to make it easier for them.
Wonderful, wonderful. Raquel, one of the things that Goodwill, you provide training, skill training for IT and for construction and other trades, all for free, which is incredible, right? All for free. What are you seeing as far as the workforce? And you do all this because there's a workforce shortage, right, in those particular areas. How are you working with employers to attract and retain? Because that's a big deal, right? Both of them, attract and retain employees.
Yeah, I think so. Something interesting about my role is that I sit both as a practitioner of workforce development solutions for employers, but I'm also an employer, right? So we have the store, so we also see what's actually happening to our own team members. So of the 1,200 team members, my team is also in charge of providing solutions to our retail partners, right? So we get to see it both, right? It's almost like we're in a lab in which we test things with the community, and then we come back and we tell our retail team, can we talk a little bit more about the orientation, and then practice that, right? So we are in an interesting seat in the lab, and we continually to do that. So because of that, right, we're able to not only talk to employers as you employer, but we also do it. And some of our practices are not always thinking about what I think is the most important transition of someone who is low income, which is when they start the day of orientation to the paycheck. That's really incredible moment when you're gonna lose your employees because we may not be asking the right questions. So transportation is one that comes up. So in those 3-week period, it's really important for us to understand if transportation is a barrier, if childcare is an area of importance, because we actually train our participants to prepare themselves when they start a new job. So what are we not asking that question as an HR manager, as an employer, to ensure that actually we may be able to be the gap during that transition, and we have somebody who will stay for us for years because we actually impacted them really importantly in an important time in their life. So they may not have a car, they may have childcare, but more importantly, we ask the question and care. So for the same we do with employers. So the thing that we really want to do with employers, not only think we are a solution for talent development, but we also want to talk to you about what our participants are telling us, why they want to work for an organization like yours, what may attract them, what actually will retain them. So those are things that because of the role that we have, it's really important to be an advocate for those individuals who are participating in our classes, because they may be free, but they're not free to them. They still have to, they are at night. They need to actually sacrifice. If they make dinner for their families, we actually are rigorous. So they have homework that they have to do. They actually have to qualify in order to come into our training. So it is important to actually shift the language in which we don't think about actually penalizing somebody because they actually need help, but actually really celebrating the sacrifices that they make themselves in order to invest in themselves, upskill and actually go back into the marketplace for a different career path. So really how to shift the mindset of employers is really our role, but only coming from the point of view of really thinking about the experiences that we want to create for both the stakeholders, which are job seekers and our employers. We really want to understand as well what our employers seek, and so our curriculum also needs to be informed by them. So we understand that actually what are the skills that they need in order to actually ensure that both parties actually are a win-win situation.
Wonderful. So let's kind of turn a little bit. Let's talk about housing. If you all recall, in 2017, I think it was 2016, 2017, there was a study that was completed, and we don't like to talk about it, but I'm setting the stage, right? I think everybody wants to not talk about it anymore, but it's there, right? 2017, there was a study done by a researcher by the name of Raj Shetty, who basically a part of that would just quite frankly, was that Charlotte was ranked 50 of 50 for upward mobility. And what that means is that a child who was born into poverty moving out of poverty in their lifetime. Okay? So we were ranked 50 of 50. And y'all know Charlotte. We don't like folks to talk about us. And so that prompted a call to action, so to speak. A huge part of the reason that I took on this role at LIST was that call to action, because there was a housing fund that was raised, and my team oversees that fund. And because one of the things that came from that, one is a great organization called Leading on Opportunity. That's my shameless plug because I'm on their board. Leading on Opportunity that was created, but they did also a report. And in that report, it listed certain things that should be done in order for us to get out of that, right? And what does it take for really upward mobility? And the top thing, and you all know this, right? The top thing that was said was that lack of housing was an issue in order for us, for our children even, to be able to succeed, not having access to safe, decent, affordable housing. So I start there because I think I want to pose this to the entire group here. What is the correlation in your work that you've seen? You know, we've got Janet, childcare. You know, you've talked about transportation, Cynthia. So where does that all fit into this spectrum? And all of you can kind of chime in.
So my prior career was in crisis assistance and rental assistance, utility assistance. I was at the ER of financial crisis in Charlotte for about 8 years. So loyal to my organization, I also created a sort of backdoor program at Goodwill. So we have been seeing that actually the goal of that program was actually not having people to have to go to the line at crisis assistance to provide the services. So it's sort of like a back office role that we have. Unfortunately, it's becoming a little line now. So that number keeps increasing. Every year, I'm seeing that number double. So it continues to increase for rental assistance primarily, right? So that is an indication that people who are actually seeking sort of the ER role that we have in this community, it's not just going to crisis assistance. They're going to other locations to find aid. It is a big signal for me that actually there's so much housing instability that actually impacts people at the point that we know that we're not going to see it until it's too late, when they're homeless. So really, if people think only when they're already out there, imagine the stress level for someone who's trying to educate themselves to go to a class, and they don't know if they're going to be padlocked that night. So how do you concentrate in that class? So it impacts our outcomes for people to actually focus on their classes, but more importantly, it impacts everybody in the household. So I will say housing is one of those areas in which we know we discover that people are taking classes and they're living in their cars, but for us, the signal is actually the amount of people who are coming for rental assistance on a daily basis at our location.
And I would agree. I think, you know, the basic need is housing. It is one of the basic needs for individuals. And I've lived in Charlotte for 11 years. We've been talking about it all the 11 years that I've lived here. And I'm quite fatigued about the conversation. I don't think we have a shortage of housing. We have a shortage of affordable, the true definition of affordable housing. I see these high-rise apartments going up. I see these developments being built. And so others who can afford it are getting the housing that they need. I see neighborhoods being gentrified and people pushed out of their neighborhoods. And so to me, that's a problem. and how do we address that? I'm really grateful to work at Atrium Health, where we have what's called our Hope Housing. It's a hardship support program for our teammates, where we've partnered with several apartment complexes to give income-based rental properties to our teammates. I believe it's some of the properties are open to our patients as well. But if people don't have a place to shower and live and have safety, it's very hard for them to show up to work. So we've addressed that. We also, at Atrium, I'm very proud, we have a fair chance hiring program where many of our individuals, they're coming home from prison. They often go to a transitional home where there's a time limit on how long they can be there. And then we are able to pipeline them into our Hope Housing program as they become employees of Atrium Health. So a lot of them have never had their own place. And it is so rewarding to see them be able to get their own place, their own furniture, and utilities in their own name. And so I just think as a city, there's a lot of money circulating in Charlotte. We keep talking about this housing crisis, and I'm just perplexed why it's still an issue when I see all these high rises going up all the time. So.
Somebody say amen. All right.
Just add 2 other points. If you don't have childcare, a parent can't work. If you don't have stable housing, that impacts your employment. So they're interrelated. And I guess 2 other things that Child Care Resources does that I haven't mentioned is, one, we manage the county's child care subsidy program. So we manage about $95 million of child care subsidy for families who are income and work eligible. That child care, as I said, is about $16,000 a year. Average annual rent right now is around $17,000 a year. So you see, affordability is a huge issue. And if you can't find stable housing, affordable housing, you can't find childcare, you can't work. The other piece is that we also are the primary workforce development resource for the childcare field. So we are often in programs training classroom teachers and program directors about how to deliver quality services or how to improve the services based on their own goals. That said, the childcare workforce, which is predominantly women of color, over 70% women of color, are abysmally paid. Childcare pre-pandemic wages, $12 an hour. With federal supports, $14 an hour, maybe $15 an hour. Fast food, big box stores, call centers, all are paying more than that. So this combination of affordability across housing, across childcare, across our early education workforce, it impacts all of us. It impacts all of the issues that we're dealing with.
Okay, thank you for that. Thanks, Janet. So let's talk a little bit about solutions. We've kind of given a general the why. What are some solutions that you'd like to provide to this audience as it relates to employment hurdles, barriers, including policy? Janet, you mentioned policy. We're in an interesting environment right now in politics. So, I'm gonna leave it at that. So, my team is like, oh, what's she getting ready to say? What's she getting ready to say? They getting ready to hit the door. So I'm gonna leave that at that. So, what are we talking about? Let's even talk about policy, because we have a whole room full of folks here, obviously, who are concerned, right, about this issue. And what would we say? What do we need to say to them if we could wave the magic wand? What do we need to say to them to say, we need y'all to do this? We need you, when you walk out of this door, this is what you should be doing for the betterment of our residents and our communities here in Charlotte. What does that look like?
Go first. Specific thing that's going on right now.
For me, this is all these issues. This is about public will. And how do we engage our community and create the will for the kind of changes that we want? Because childcare won't change, housing won't change unless we engage stakeholders and influencers and decision makers about what's at stake, right? And so the question is, how do we do that? How do we do that effectively? I lead a team of advocates, and I have one voice, But when the CEO of a business, your business, steps up and talks about childcare, it's a different voice, right? So how do we be strategic about what our critical needs are, our critical priorities are, and level influence everywhere in your community, in your faith institution, at your job, and in whatever political kind of affiliations you have, communities, et cetera. So to me, it's fundamentally about public will. I'm fundamentally an advocate, but it's using advocacy and harnessing voices and really influence strategically. And I would just say one thing. I'm not talking just about in the public sector here. I'm also talking about in the private sector,
Right,
because there are lots of strategies that folks you know can employ, whether it's in your workplace or in your community, to help improve access to the resources that we're talking about. So for me, with employers on childcare, there are an array of kind of family-friendly benefits, and there are employers in this room who employ an array of family-friendly benefits to reduce these barriers to employment, support their employees' childcare needs, support the costs, have flexible policies around leave, have flexible policies about emergency childcare. I could go on and on all day. That's not what I'm here to do. But it is about educating yourself about the issue and then speaking up in the spaces that you have access to and trying to influence change.
Okay. Okay.
So I will say this about the political atmosphere of Mecklenburg County is really open, but there are things that will preclude us from actually achieving them if we're not paying attention to the state. So the state has a lot of say in what actually we could do. Transportation is one of them. So I think if you pay attention to our transportation conversations that we're having and which we want to expand, pay attention to what has actually happened at the state level. That will urge you to do that, because then you could actually be more informed about where things may not be happening in Charlotte as well. But I'll say that around policy or things that you could do as solutions as an employer, just think creatively about what an integration could look like, right? So as an employer, we think about what are the things that we could provide solutions to our employees, our team members. So our HR has provided a free access to care.com, right? So our membership gets paid by us. And so if they have a last minute urgent care that they need, they actually could go to the site and look at that. They're not cheap, by the way. If you're a mom, or parent, I should say a parent, So that's something that we can provide. It's an easy solution for that is not as expensive for us, but it actually be significant for our team members. We partner with Commonwealth Charlotte to provide small loans for our team members. So it's something that we're thinking about, they don't want to come to us for that. We do have things that are actually for emergency, but they actually could go to them and do that directly. We also have access to classes, and there are a variety of things that we think about, like coaching opportunities. We have coaching for our participants. We created a coaching model for our own team members in which they could go free of charge, and they have a coach if they want to buy a home, they want to work on their studies, they want to work how to move up in their organization, is free to them. And that's something that's access to really how to do social mobility. And the last thing I'll say, we have to train our managers, because there's no one who will impact more a team member than the person who will make decisions for them. So we have a team that actually is dedicated to also make sure that there's leadership development to increase the EQ of our team, of our leaders, because they may have antiquated way of thinking, and our new generation is really challenging us to think differently and really saying why, but why, right? And it's not a why that is actually saying we don't believe what you're saying, but really think through what the decisions that you're making as an employer that impacts my life. All these barriers that we talk about are behind their head when they're asking why. So really thinking significantly the role that you play as an employer in the livelihood of people.
Absolutely.
And I wanted to kind of take a spin on that policy question. So as you can imagine, in healthcare, we need a lot of credentials, licensing, things that are required to touch a patient, to be around patients. And so even though we have this fair chance hiring program where we consider individuals who have a criminal background, if they want to go into some of these roles that require a license or a certain credential, there are licensing boards that say, your background precludes you from getting this job. And so I have talked to some of our government relations people. Like, we need to now go to these licensing boards and talk about the barriers they're creating for individuals who've served their punishment. It's over. Justice system has said they've completed their, whatever sentence. But now we're limiting their career for the rest of their lives in some instances, simply because a licensing board says you can't get beyond this point because of our rules. And so if there was a policy, I guess, issue for Atrium, I would love for that to be addressed as well.
So looking at internal policy. So from what I'm taking from this social capital, so making use of our social capital as you are in rooms where you see that other people aren't in that room. That's really important. So looking at social capital, educating yourself on this issue, speaking up, loudly when you need to be able to advocate for others. And you can't look at just local policy, you gotta look at state policy. We should be paying attention to what's happening on the state level. I know sometimes we kind of get, and I admit I do the same, sometimes I get into this bubble in Charlotte where, okay, it's Charlotte, but really what's happening in Charlotte is because of what's been decided at the state level and then what's been decided in DC, right? And so we've got to probably, I would say all of us probably could do a better job of making sure we understand that and really track what's happening. And then looking internally at internal processes, how can you look at internal processes? One of the things that I do want us to put in the room is the fact of, a couple of years ago, a lot of organizations made a diversity commitment. We are committed to diversity right after the murder of George Floyd, right? You all know that. That you saw everyone say we are committed to doing this. Being committed is one thing, and walking the walk and talking the talk is another. So I think what I'd ask of this panel is, and Raquel, you mentioned that, as far as like hiring practices and things that you do internally to ensure that your staff succeeds, right? And that folks have access, and not just your staff, but other people coming in have access, and training of our leaders now more than ever is important. My team knows that. I'm very big on that, is making sure that, my team has that leadership development that they need to be their best selves, not just with lists, but outside. Once they leave lists, heaven forbid, they leave lists and outside of that. So what are you all doing as it relates to that? Raquel, I'll start with you because you started talking about like the training of managers, understanding when there might be bias that is there, unconscious bias that is there.
Yeah, I think we all grew up in a way in which what we believe and what we were raised to believe is the truth, right? And then there comes somebody who comes 20 years younger than you and says, well, let's think about it a little bit differently, right? And I love that, because that challenge really thinking about, is the rule that we created or the time that we created make sense for today? And that's really looking at our internal policies that impact people. So I can't do that if I don't understand the barriers that people are experiencing and the impact that they're having. So I think we have to start there first, right? Because sometimes, right, we talk about certain groups, it actually impacts anyone. Anyone that actually has a child, anyone who actually depends on transportation, right? So we have to think about, we may assume that it's only impacting one group, but it's actually probably impacting every group in your organization, and you're just not talking about it. So that's one way to think about it as well, right? We typically think about the solutions that we have for one group, it's only for that group. Really, it actually levels up for everyone who actually works for them. Because now we're thinking differently about how it could impact a human being that works for us. I'll start there. But I'll say the things that for us that are most impactful is really that we listen to our team members. Right, that we ask questions so we could actually find solutions that impacts them and the way that they want to be impacted. Because we don't know I don't know what it takes for them to come to my workplace or where they work. I'm gonna add one more thing, is that also just increasing wages doesn't mean that it will be a great solution. So we know, because of the work that my organization is doing around the benefit cliff, is that we could actually impact negatively. It just reminded me with the subsidies, right? So if someone is actually, if you know about benefit cliff, it's this idea that if your income actually raises at a faster rate, that you could actually replace the cost of the public benefits, you could lose all the benefits. So even if your threshold is $1 and your benefits actually could be $16,000, you lose the entire thing. There's not a progression for you to lose that. So when you think about that, how do you, even when you're trying to do something positive, I know the hospital had that lesson, and we're doing a partnership with them, is really how do we understand what would impact individuals if you understand what is actually primary to them. If they have housing vouchers, and if they also have childcare vouchers or subsidies, you can't just say that you can increase that income and they'll solve all their problems. It may take about $40,000 for them to be able to afford all the things that they get in a subsidy. So I will say that those are the things that for us were big lessons learned, because we were trying to be kind, but we were harming people in our kindness.
Janet, do you want?
I will say, in addition, it's sort of recruitment from the very beginning, from what does your front door look like, and how are people received into your front door, and what do your hiring, you were talking before about sort of barriers. What are your requirements for positions? If a degree is a requirement for position, why is that degree a requirement for position? Who does that leave out? And how do you create pathways in? And so I think we've done that intentionally and need to do more of that. Obviously training as well. And in our workforce, it's really reshaping in childcare licensing policy, for example, very higher education focused, and we're very supportive of higher education. But how do we create pathways for folks who haven't been able to access higher education, and sort of think about our job requirements and how we advance in our field in new ways, in additional ways.
I like what you just said, Janet, as far as looking at the requirements for the jobs. Our talent acquisition team is doing that now. Many of our positions, why do we require a college degree for this position if you're transporting patients from room to room? So I'm grateful that that is beginning to happen. One of the things we also do is pay our employees with a success coach. So this is someone who's just one-on-one, once a month, maybe a 15-minute call, just checking to see how things are going. Do you have enough food? How's the job going? I think that constant check-in, at least for our workforce development participants, and that's the audience I'm referring to, it has really helped open our eyes up to what the needs are. I like what Raquel said as far as ask them what they need. They may not need it right then, but at least have someone who is constant, at least once a month, being able to do a check-in with those folks to find out what's going on. As far as the access to education, I know a lot of employers have education benefits, but it's often a reimbursement benefit. Prepaid was a game changer. We implemented ours about 2 or 3 years ago, and when you have prepaid tuition assistance, it really increases the access. It opens doors for individuals who need to get a credential or need to get a degree to advance in their career. And that is what helps with retention and engagement, morale, all of that. You'd be amazed. So.
Wow. Thank you. Thank you so much. We're going to open it up now for any questions that you all might have. Yes, sir.
I have a question about set-asides. Is there any report on the set-asides for housing that were asked of new builders in the last 10 years? Is there kind of a report?
When you say set-asides, what do you mean? What do you?
So if you build a condo, then 12 of those condos are made affordable.
There is, I don't believe that there is a report. Typically what happens with that is that if you're building, depending on, well, there's a few things without me going into a whole affordable housing one-on-one class, but if the city is putting in money or government is putting in money into any affordable housing development, they can say to the developer, right, you would have to have X amount of units that are for a tenant who is of a certain income. It depends on the development. It does not depend on it has to be 10% or it has to be 20%. It depends on what the city is given, how much they're given, and it depends on the development itself. For us, if you're getting, because LISC, we provide financing for affordable housing developments. For us, we look for a range. So a lot of our developments are for families who are what we call low to moderate income, which means 80% of area median income, which also means, because I know we use a lot of acronyms in affordable housing, which is interesting. But what that means is a family of 4 that makes about $73,000 or $74,000 a year. That's what that means. So it just depends on how much, and it depends on what is the particular development, how many units is the development, and things like that. But sometimes they don't. But it just depends. That's a kind of, and I can more than happy to talk to you about that after.
Yeah, I was wondering if we were 100% or 50% in terms of people actually doing what they said that they were going to do.
They would have to be, because they have when they get those monies, those monies are monitored. So they would have to, if they get, $1 million or $2 million from the city or even from us, we're monitoring that for the next, 15, 20, 30 years. So they would have to be. So any other questions? Yes. Hey.
Hey, good morning.
Good morning.
Thank you all for sharing what you shared today. Oftentimes this topic is viewed as philanthropic or feel-good type of stuff. But it's really an economic development conversation, right? So can you all speak to, I guess, Cynthia, really with your work with Atrium, the impact to your business objectives for solving some of these challenges?
So a lot of our programs, we're looking at critical roles across the system. So one, we had to find out what the critical roles were. Nursing has been there forever, and so we create these programs and pipelines to bring individuals from the community, even our existing workforce, to help fill those critical roles. I think as an organization, we're doing a better job, again, by supporting the folks that are there to keep them in the roles. The healthcare worker shortage still exists. So I think by implementing a lot of the support systems for our teammates, it's helping them grow and stay within Atrium Health. It's a high cost of turnover when people leave and you have to replace them. So I think just offering the support to our existing employees, and even, again, going out in the community. We have a few high school, we're getting kids exposed to healthcare. We're more than doctors and nurses. And so very early on, trying to expose the kids to the breadth and the broad array of careers that exist in healthcare, I think is not only educating them, but sometimes they're educating their parents about the opportunities that they can do for their upward mobility. So we're meeting business needs in some way by helping to fill those critical roles, but I think Atrium also has a responsibility to the community by going out and offering these jobs and making sure that people can work where they live as well. So that's just one of the ways, is addressing our worker shortages.
Any other questions? Yes, ma'am.
Yes, it's kind of along that same question. I know we talked a little bit about public policy, but how do we get buy-in from the private sector? So we're talking about all these amazing things that Atrium is doing. How do we get some of these other really big employers in our city to have similar programs, so that it's Atrium's doing amazing things, like especially the Lift Pass, like that is life-changing. How do we get other big companies to do similar things?
If y'all haven't heard it in my tone a little bit, I don't sit in conference rooms too long about a topic. Just go do it. It's not that hard. Lyft has a business office that you can call, and they will be happy to set up an account for your business. I think it's just, one, let's meet a few times, not too much. Let's not sit around and talk about this a whole lot, because I say it simple, but there's layers. And have people that are your doers. You need your strategy people. You need them. But you also need your executors and the people who will get things done. So in my opinion, have those two people come together and just do it.
I guess I would just add, from an advocacy place, your employers are having trouble recruiting employees. Benchmarking what your competitors are doing and sort of adjusting is important. So I mean, even CELC is here and convening this organization.
I was going to say
And
that, but
so the CELC is a sponsor here, and so having this conversation within the CELC construct, sort of identifying what these innovative strategies are, sharing the strategies, but we're competing in many cases for the same workforce. So I think the employers that really lean in benefit, and then others notice that benefit, and a small employer can't do what an Atrium can do, but there is something that every employer can do to sort of think about how it is to make work more accessible for their employees.
And I want to make sure, again, we use acronyms. The CELC is the Charlotte Executive Leadership Council. So it consists of many of the CEOs of companies who are based here in Charlotte. So, and so when you're talking about, how can you advocate, how can you get the private sector to come along with you, that's a good start. And they have staff that are here to be able to listen to you and listen to what you're saying. But also, again, and I go back to just making use, being in rooms like this, but also making use of social capital of others as well, making those calls, being in the room when others aren't, to be able to be an advocate as well. So I definitely understand what you're saying, and
now,
when it comes to bringing the private sector on board.
And I think it has to be a talent solution problem you're solving, right? It can't just be something you want to do for your team, right? So it is something we typically we're going after something we're trying to solve, and then people go at it with just throwing money at it, right? And actually, when I talk about the people, it's actually thinking about why we're doing it this way, and then testing it and see if it makes a difference. And if it starts making a difference, then you can then go to your boss and say, this is why. So this is important that it has to come from a problem you're trying to solve.
Okay. We have time, I think, for one last question. Yes, ma'am.
Thank you all for sharing your the information about your organization. We've heard a lot about the benefits that are being offered, and flexibility is certainly really important for employees. But have you looked at the cost effectiveness of just paying someone a living wage as opposed to offering these benefits? That has not been really talked about.
I mean, I would say for us as a retailer, right, we're competing with people who pay less than us. We had to actually really dig deeply into actually every year committing to increase it by $1, which actually in our budget is $1 million, right? So really then at the same time they're asking us, could we also have benefits? So it was really hard for us to actually step through it. Thank you for asking that question, because nobody asked that, right? Like how does, and particularly in retail, right? Like people are not used to doing that. How do we shift our mindset? And it took mindset shifting for us to say we're going to stop doing certain things to really expand on salaries. And I think that it takes courageous talks to be able to do that as a company. And we're a nonprofit, but we still are an employer. So I think it's important that to start asking those questions. And I'll tell you that's our employees that are saying, just pay me more, right? But we also are thinking about the future and sustainability of that employee. They're not thinking that they're going to have an emergency in the future and how they're going to actually do that if they don't have benefits to do that. So we're also trying to do both at the same time.
And I would agree, Raquel. I think at Atrium, we do have an Atrium Health minimum wage that every year it continues to increase for our teammates. I know there's some Bank of America people, like we're always looking at what is Bank of America doing? And so we continue to try to meet, it's a high bar. And so we do have that, always looking at, at minimum, what are our, and it's way above what the state minimum wage and even federal minimum wage are. But that is something that our leadership has taken into account. A lot of our, even during COVID, we gave our healthcare workers bonuses and additional pay and different things to just try to help, because there was a lot of hardship going on at that time and even still now. So yes, it's a good thing to consider. I certainly know that we can do more, again, because the cost of living in Charlotte is through the roof. And so I look forward to the day when our minimum incomes or our minimum threshold meet what it takes to live comfortably in the city of Charlotte.
Okay. All right. Well, this has been great. Thank you all so much for attending today. If you have any further questions, we'll be around and look forward to have a great day. Thank you.